So Senate Bill 2012 was introduced at the beginning of this session as the Senate's flagship bill, which would basically provide additional $500 million for repair and maintenance for all of our state facilities, including hospitals and schools, airports. One of the reasons why I wanted to come here today was as we move through the legislative process, we're really trying to encourage some of our other legislators, our colleagues on Oahu, and other parts of the state to realize the importance of repair and maintenance and making sure that we can upkeep with some of our state facilities. I just wanted to make sure that I had an opportunity today to come and see what some of the needs might be here at Maui Memorial Medical Center and to really try to make sure that the entire hospital is state of the art. I think spacing is an issue. There's some health and safety issues with the elevators here. So, I think there's a number of things that we'll be able to work on through repair and maintenance to try to create greater efficiencies. And, ultimately, we just want to make sure that as some parts of our hospital starts to age, that we continue to have the financial resources to make sure that it maintains and we can extend the life of the facility.
The hospital, we have some improvements, but we've been building this hospital since 1952 and adding on to things. So certainly, we try to provide the best care we can, and I think there's a lot of things, but things have changed and the delivery of care has changed. And, when you have old, tired facilities or infrastructure, you have to keep on putting money into it because in a hospital, you can't stop taking care of patients. You don't have the ability to go down. If an elevator goes down, how do you transport that patient? And yet the elevator is, probably 30 years old. And so you need to continue to be able to provide service and keep up with repairs and maintenance because, in healthcare, you can't afford it not to work. So we have a lot of issues like that. We're in a lot of cramped spaces. Temperatures go up because of the equipment. There's more fancy procedures we need to do. And so, we got to keep up with our repairs and maintenance. And if we don't, we'll continue to try to do our best, but it is not the ideal environment.
People don't look at repair and maintenance as being something that's exciting. It's always more exciting to have a new facility. But, as we see here, like in a hospital, there are a number of repair and maintenance issues that are health related. We took a look at some of the older sinks, and in hospitals, apparently we shouldn't be having sinks where, people need to touch the levers. Most of newer hospitals or newer areas have sensors built in. And so, there's some sanitation issues and, there's molding issues that obviously we want to make sure we avoid. And so as part of that is the continuous upgrade of the facilities. So the repainting and the, redoing of wallpaper and et cetera is kind of important for health purposes as well. Currently, the bill that the Senate passed over to the House didn't get a hearing. And so what we did was we took one of the House bills and again reinserted some of our language. So beginning next week, we'll enter into conference and we'll try to have a discussion and hopefully we can get our colleagues in the House to realize the importance of this measure.